Now, all eyes are on Jefferson City. Missouri Governor Mike Parson is set to give an update on the COVID-19 situation in the Show Me State in 1 hour. You'll be able to watch that right here on KMBC. Now, this comes as the state continues to deal with critical staffing shortages and more than 2,600 people hospitalized with COVID-19. That is up by more than 1,000 from last month. Good afternoon, everyone. I'm Kelly Eckerman. KMBC 9 News has learned the governor will be announcing new help for medical staff. KMBC 9's Michael Mahoney is joining us live now with a closer look at why this is happening. Michael?
Kelly, you summed it up pretty well there. Missouri's most serious problem right now is medical staff shortage. Most places have enough beds, but they're tight on staffing, and that's because, like a lot of other people, too many of them are getting sick. According to very knowledgeable sources, a big part of Governor Mike Parson's plan will be a state partnership with a company called Vizient and have them provide fill-in medical staff. It's one of the things the company does.
We have a number of staff across probably all of the hospitals that are out sick with COVID or are home taking care of kids or family members that have COVID.
Hager leads the Mid-America Regional Council's committee that watches the Metro's hospital situations. According to the Missouri Hospital Association, 25% of the 15,000 Missouri General Hospital beds are available, but there's not enough people to staff those beds.
Doctors, nurses, housekeepers, and everyone else are no less immune to COVID than what the general public is.
And for the most part, medical staffers are catching the virus out in their communities, not at their facilities. Now, neither the governor's office nor the company would comment on this story, as sources are telling us that in an hour, Governor Mike Parson will announce a partnership to bring additional medical staff into Missouri to help fight the virus. Michael Mahoney, KMBC 9 News.
Again, you will be able to watch that announcement live right here on KMBC 9 News at 5 o'clock. The University of Kansas Health System is making changes this week to curb capacity issues at its main campus that's brought on by the coronavirus. Doctors have started moving patients from KCK to the system's Indian Creek campus in Overland Park. This is to free up bed space. They say they're only transferring patients who are able to be moved by ambulance.
This shift of patients to Indian Creek helps us increase bed capacity to care for more complex patients or patients with more complex care needs here on the main campus. It's a good example of the ways that we are trying really hard and sometimes creatively to manage capacity to make sure that everyone who needs it can get it.
Doctors say transfers are up right now as patients from rural areas are brought to the Metro for COVID care. The situation in a small town in northeastern Missouri is dire. At Scotland County Hospital, all 25 beds are full, and nurses are now working 24 extra hours a week. The hospital usually cares for people from 6 different counties. Doctors say the situation is so dire, they tell infected people to go home and come back if their situation gets worse. Right now, cases in Kansas and Missouri are going down. The 7-day rolling average of new cases in Missouri is down to 2,600. In Kansas, the state has added 4,600 new cases since Monday. The monthly positivity rate in Kansas is down to 17.1%. In Missouri, the positivity rate remains about 20.3%. We are almost a week out now from Thanksgiving, and demand for COVID-19 testing is surging again. Appointments are filling up. In Johnson County, Kansas, some big changes are on the way to meet that need. Despite recommendations to stay home for the holidays, Thanksgiving had people on the move. People clamored to get tested for COVID-19 beforehand. A week later, that demand for testing is back.
We've seen already that this virus doesn't bend to our rules. It doesn't listen to what we ask of it. And so we just kind of have to be in that sort of, you're prepared as best you can be, but you have to be able to adjust and react.
Johnson County is reacting by putting together several more large testing sites. It's working with the state to get those open this week or next. All appointments are filling up, and it expects that demand to only increase in coming weeks. Jackson County is seeing the same thing. All testing slots are full. It's not currently taking appointments. If you were exposed to the virus over Thanksgiving, it's recommended you wait 5 to 7 days to get tested for an accurate result. Health officials say testing is an important tool to understand progression of COVID-19, but preventive measures like wearing masks and social distancing are still critical. And there's concern about the consequences of people choosing to gather for Thanksgiving.
As you increase the number of cases, you increase the number of potential exposures. So if more people have COVID-19, there's a higher chance that they will expose more people. It's just sort of a numbers game.
Health leaders in Johnson County, Kansas say testing is limited due to the high demand. You can schedule an appointment online at jocogov.org/schedule COVID-19 test. This is only for Johnson County residents. They say that new appointments are added each Thursday. In Kansas City, Missouri, you can call 311 for a COVID-19 test. The Kansas City, Missouri Health Department is offering 2 testing events this week. One is tomorrow at Central High School. Another is on Friday at the Parks and Recreation Department. The CDC is now trimming its 14-day recommendation for COVID-19 quarantine. There are now 2 options. The first is to end quarantine after 10 days if no symptoms are reported. The other is a 7-day quarantine, and that's if an individual tests negative and has no symptoms. The CDC says this decision has been under review for weeks now. Even with the shortened quarantines, though, people are still urged to monitor for symptoms for a full 14 days after exposure.
If one is following someone for 7 days versus 14, and then particularly if you have a negative test, that really is likely to have a much more positive impact than people who say, well, I can't do 14 days.
The CDC is also urging people not to travel for the upcoming holiday. Those that do travel should get a coronavirus test 1 to 3 days before leaving, and then again 3 to 5 days after you return home. And the race is on for a vaccine. Today, the world's first ever coronavirus vaccine has been approved in the UK. Now, that means people could be getting the vaccine in just days from now. Health officials approved the Pfizer-BioNTech vaccine early today, announcing 800,000 doses will be available in Britain starting next week. The first to receive the vaccine will be those in healthcare and nursing home residents. And here are some of the dates to keep in mind for the U.S. December 10th, the FDA will consider Pfizer's application for an emergency use authorization. December 17th, the FDA will consider Moderna's vaccine candidate. Experts say it may be the spring, though, before vaccines are widely available here in the U.S. We are closely monitoring developments in the coronavirus situation around the area, the country, and the world. So for updates on cases, testing, and vaccines, visit our website, kmbc.com, or you can download our free mobile app.